Okay, do you see my PowerPoint presentation?
Yes.
Okay. Good. Okay. Good morning, ladies, gentlemen, and colleagues. Today, I would like to present our research, identification of Tanapat and Go components in elderly with chronic neck pain. My name is Tanapat Thongprong. As a presenter, my advisor is Association Professor Lampa Bunsinsuk, and my co-advisor is Nithinan Kiri from the Division of Physical Therapy, Sinakrin Wilod University. The chronic neck pain is a neck pain that takes time more than 3 months. It changes about in anatomy and physiology. Signs and symptoms of chronic neck pain is below as neck pain, dizziness, lights spinning inside the head, limitation of movement, limit functional movement of cervical joint, and impairment of postural control. The possible cause of balance impairments. Cervical proprioceptor provides the central nervous system with information about the movement and location of the head in relation to the trunk. There are specific connections between the cervical receptors and the visual and vestibular system in the normally situation. The chronic neck pain is implied incorrect information from any of these sensory input will cause a sensory mismatch between abnormal cervical spine and normal information from the vestibular and visual, resulting in disturbance of the postural control system. Previous study, elderly with chronic neck pain demonstrate balance impairment in static and dynamic balance. The result is impaired static standing balance, perform modified CT-SIB, as in condition comfortable stand on firm surface, comfortable stand on soft surface, and narrow stand on firm surface. For impaired dynamic walking balance, perform 10 meters walk test with and without head movement. The impairment are indicated by increasing total time, cadence, and gait cycle duration. The another previous study confirmed that elderly with chronic neck pain show impaired dynamic balance when performed Tanapat and Go test. Elderly with chronic neck pain took longer total time duration and got poor dynamic gait index score. The Tanapat and Go test is the clinical scale that was developed to identify persons with dynamic balance deficits by measuring the time they took to complete the test. It is consisted of 4 complex movement components such as sit to stand, walk, turn, and turn to sit. As previous study, elderly with chronic neck pain indicated dynamic balance impairment by total duration of Tanapat and Go test. From review of literature has no information regarding which components are impaired in elderly with chronic neck pain. So, our objective is to identify the components of Tanapat and Go test that was impaired in elderly with chronic neck pain as compared to those without neck pain. Cross-sectional study conducted in 30 older participants consisting of 15 elderly with chronic neck pain and 15 elderly older adults. The inclusion criteria is participants were 60 years after older. Participants were 60 years or older, male and female. For elderly with neck pain, they had to get pain more than 3 months. The participants they were excluded from the study if they met at least one of 9 exclusion criteria. The questionnaire used to screening characteristic data of the participants, such as visual analog scale, neck disability index, the activity-specific balance confidence scale, and the dizziness handicap inventory. The instrumented time up and go form or ITAC software from APDM Mobility Lab System. A 6 of portable accelerometers and software was used to identify the component of time up and go. The 6 accelerometers located at middle of sternum, the dorsum of wrist both sides, the middle of shank both sides, and the posterior tongue at the level of L5. The raw data were plotted as a signal graph by peak angular velocity of trunk, movement at sternum. The components of time up and go, including sit to stand in the first peak of movement, walk, turning in the another axis, and the last one, turn to sit. All components were classified by peak, trunk velocity, and acceleration. Descriptive statistics used for the participants' demographic data. Independent t-test for the general characteristics, duration of time up and go, and time up and go components. Additional, in chronic neck pain group use NDI score to categorize to 2 subgroup and independent sample Mann-Whitney U-test for between chronic neck pain with mild disability and control. The other one for chronic neck pain with moderate disability and control in duration of time up and go and time up and go components. The demographic results, there were no significant difference in age, BMI, and ABC scale. And for clinical characteristics were significant difference in NDI, DHI, and VAS in chronic neck pain older adult. The duration and time up and go components, there was no significant difference between elderly with chronic neck pain and control. So subgroup analysis was performed and results shown as table 2. Chronic neck pain with mild disability show significant longer than healthy control in sit to stand, turn to sit, and time up and go duration. Because sit to stand and time up and turn to sit components are the postural transition components where a person changes from one to another body posture. They involve larger movement of head and neck in several planes of movement as compared to the movement of head and neck during straight walking. The other one parameter that indicate balance impairment, table 4, demonstrate mean value of peak, trunk, angular velocities of time up and go components between subgroup elderly with chronic neck pain and control. trend of higher peak tongue angular velocity is appear in chronic neck pain with moderate disability during walk, turn, and turn to sit. So the discussion is the balance impairment during perform time up and go can be seen on different outcome variable. Chronic neck pain with mild disability demonstrate longer total duration, time up and go duration while maintaining relatively lower peak angular trunk velocity during all time up and go components. In contrast, chronic neck pain with moderate disability show larger peak angular trunk velocity during all components of time up and go, which add an indicator of higher trunk sway during time up and go performance. The explanation could be due to the trade-off between speed of movement versus speed of trunk control, such that chronic neck pain with moderate disability prioritizes their trunk control over the speed of movement. So the conclusion is the sit to stand and turn to sit component of time up and go test were marked impaired in elderly with chronic neck pain. For the further studies, whether the use of NDI score is the most appropriate method to categorize elderly with chronic neck pain when assessing their balance impairment. And our suggestion is apply in active older persons in the community with no fear of fall. And the clinician should be emphasized balance training in sit to stand and turn to sit component. Thank you for your attention.
All right. Okay. Comes to questions. Okay. Anyone have questions? Please. ค่ะอาจารย์เชิญถามได้เลยค่ะ
Okay, I'm Dr. Thongprong นะคะ Thank you so much for your presentation, and it's really interesting and it's my field, but I'm tend to do the turning function with the chronic neck pain in the future. The question for you is, you do the people with the chronic neck pain and it related to the head movement, right? And your primary outcome is the peak trunk velocity and acceleration. What do you think about the head movement, or why you choose that one for the primary outcome?
Thank you for your questions. For my primary outcome, or the main objective of our research is to identify the time up and go components, what is happen in each 4 components in which one is impaired in the chronic neck pain. So for about the peak angular trunk velocity is not my main objective, but we found that they have two parameters that can indicate the balance impairment. So our objective just identify and found which one happened in each phase of time up and go. Another question is for the neck movement, right?
Yes, it's okay, but yeah, it's back to the chat with Dr. Piani that I think is related to my question. Could you describe about the mechanism impairment during the chronic neck pain, and it's related to your thumb up and go, something like that.
Okay, okay, the first question is describe the mechanism of impairment postural control related to the chronic neck pain. For my literature review, I found that the impairment of postural controls is happen because the chronic pain that change the muscle property in the neck region, that includes the muscle spindle inside the muscle fiber, and that I said before, the postural orientation and the postural impairment is happen because when the measure of the balance control of a human body system consists of somatosensory, visual, and vestibular system. The neck is the one of the somatosensory that relate, that have some pathway or some connection between the visual and the vestibular system also too. And I said like when the normal information from vestibular and system mix up with integrate with the abnormal information from the change of sensory afferent input from the neck. When they mix the abnormal thing with the normal information, so so maybe the mismatch integration in that point make an postural control orientation impairment. Yes,
it's almost it's about the afferent fiber, about the neck or conjoined tendon organ, something that is produced about the sensory control in the reorientation of the body. But if you consider more about thumb up and go tasks, they have 4 components that you told us. And yeah, if you consider about what the first one to reorientate with the body, something like that, you will link about your information and your taste. And I think it could be stronger for do the next publication or something that you can find out later. And I'm sure Dr. Rampa will help you about this. Good job, Ka.
Thank you for your advice.
So we still have time, Adan Sangfa. We still have another question, several questions. Okay, what suggestions of the clinical indications would you like to guide physical therapists for applying the patients?
Okay.
Yes.
For my study, I would like to suggest like clinicians should be concerned in the elderly with chronic neck pain might be figure out balance impairment. It can be assessment by the thumb up and go test, and focus on the sit to stand and turn to sit component. For or clinician can be assessment with another test about the sit to stand or turning, and the clinician can be emphasize the balance training program in these 2 components, sit to stand and turn.
And It's another question from Professor Samit. Maybe the last question. Did you observe any change in force generated as one would expect in vestibulospinal activations of extensors to be affected if the vestibular system is the cause? Okay. Did you have a common measures to normalize the durations or the amplitude of the response you discussed? Okay, the question is in the chat. Okay, please answer.
Okay. Okay, this answer is quite for my study, we use the accelerator that located from the sixth part of the body, and the result from the software that I have is about the gait parameter and the velocity of the trunk movement. So if you ask about the vestibulospinal activity and affected the vestibular system in this course, I would like to say I cannot answer in this time. I cannot answer this topic.
I can quickly jump in. I'm not asking you necessarily about the vestibular system. What I'm asking you about is the effect, what you're describing. Could that be due to the vestibular? And if it is, which you proposed at the start, I thought that one of the mechanisms you proposed was that. And if that's the case, the force would have been something to measure along with these gait measures that you're picking up. And you sort of answered that based on the other questions where the afferents were described. And I'm not completely in agreement with the afferent conversation. Peony can explain it better probably. But I have a query which is about the amplitude and the measures that you gave. I didn't really pick up a large difference in the amplitude. So when you showed the graph, the figure 4, that you have the graph number 4 that you showed. But what I was more curious is how did you normalize? Because if these are patients, they're not going to be walking with the same speed or the same time delays, right? So what was your parameter for normalization? I'll shut up there.
You can show in your slides. Sorry, you can show in your slides during answer questions.
You mean in this table 4, right? This data is from the software of the accelerometer that they calculate at the mean of the trunk movement for me already.
Yeah, so this is one subject, not across all subjects.
I'm sorry, can you
Is this from one subject alone, or is this from all the subjects that you recorded from?
Oh, I'm sorry. Maybe my graph is not clear. It's about the all subjects that I have is the mean average of all
Yeah,
subjects.
so how did you, because if it's radians per second, but if the distance is constant, but the time they take is different.
In this part, I picking up from the software that give the peak trunk angular velocity per each subject, and so
Yes, but
average.
the velocity. Okay, I'm getting into technical. Okay. Yeah, it's an average, and I think it's okay. It just, I feel it needs a normalization factor to make it easier to follow.
All right.
Would I share my study before? I used the accelerometer before, and I used the MATLAB program to analyze my data, and I have a code or something to normalize data before we compare. And if you have your time, you can learn about that, and you can get more accurate of the data. Thank you.
Thank you for your advice, all your advice. Thank you so much.
Thank you, Professor. So, and Ajahn Thongprong. So right now we don't have time